Welcome, everybody. This is Dr. Kondrot, and thank you so much for joining. And it's good to see everybody, and I want to thank all of you for um, participating in Substack because your tuition for Substack, most of the money, in fact, I think all of it, goes to our mission work. And I'm really happy that my wife and I have just returned from Togo, Africa. It was probably one of the best missions in my life. We've been doing missions for 10 years. It was just a wonderful experience. This mission, we focused on young children with crossed eyes and walled eyes. And it's very traumatic. You know, when you're a child and you got crossed eyes, you're ridiculed at school, you're made fun of, and it really prevents your ability from being successful in life. And in Africa, a lot of the children are felt to be possessed by the demon, the devil. They practice voodoo there. So you can imagine a young child being shunned by everybody. So, you know, a simple operation to straighten their eyes gives them their life back, their entire life. And it was really moving. We had one family, the whole family traveled. The mother, the dad, the grandparents with the little girl who crossed eyes. And they walked for 2 days to come to the mission site. And you could see, first of all, the child was very happy to get straight eyes, but the parents were crying. I mean, they knew that their little baby now had a chance for life. So it was just such a wonderful experience. And I also really appreciate all of you that may have contributed to the mission cause. You can go to site.org/Kondrot, and this is a 501c3, so 100% of your money goes to mission work. There's no administrative fees or anything like that. So I appreciate all of you that have contributed in the past. But anyway, we have a lot of work to do here, and I look forward to answering your questions. And the best way to do this is to put your hand up. You all been muted, and I'm going to first call on Claudia. Hello, Claudia. I'm going to unmute you. Yep. How are you? Oh, you have to unmute. There's a little button.
Yeah, okay. I think, you hear me now?
Yep, I hear you.
Thank you for your work. My son was on the Mercy ship. That's where he met his wife. So,
Oh, wonderful.
I am confused. I have macular degeneration. I'm confused when I go outside in the sun. When do I need to have sunglasses on? When do I not need sunglasses? If I'm going out to walk down to my mailbox a ways away, do I need to have sunglasses on to do that? You talk about palming. I don't understand when I put sunglasses on and when I don't. And
Okay, well,
what about went through a glass, if I'm inside, but there's a big glass window with the sun coming in? Do I need to stay away from that?
number one, our body needs ultraviolet light. That's why vitamin D deficiency is rampant. We're not getting enough sunlight. Now, excessive amounts of sunlight is certainly harmful for your body, but we do need a moderate amount. And that level really depends on where you live. If you live in the high desert of Arizona where the humidity is 10%, my goodness, you're out there for just a couple of hours and your skin will burn. But on the other hand, if you're in the state of Washington, in Seattle, and it's cloudy all day, and you give very little sunlight, it's a different story. But you do need a moderate amount. What I usually recommend for people to do, if you're just going to walk outside to the mailbox, you certainly don't need your sunglasses. But if you're going to be spending all day, on the beach or hiking or doing some outdoor activity all day, then I would certainly put the sunglasses on. But we do need ultraviolet light. Our body needs ultraviolet light.
What about when I'm driving? If it's not is the UV protected? Is the windshield have UV, the glass,
No, I don't think the windshield of the car, but remember, our body needs UV light, a moderate amount. So if you're driving a short distance, I would not put on the sunglasses. But on the other hand, if it's earlier in the morning and you're driving east and the sun's coming into the
Right.
car, I mean, that's common sense. You got to put your sunglasses
Right.
on.
But I'm
So
not damaging my eyes more by walking outside for 10 minutes without
no,
sunglasses on?
no, I'm absolutely convinced of that. We need a moderate amount of ultraviolet light.
And we need that in our eyes itself. I mean, I'm getting it on my skin.
Well, we have, the little tiny capillaries in your body are absorbing the ultraviolet light. So, that's the biggest receptor is our body. So it's not like you have to look at the sun to benefit. So
And
that's,
what about inside of a house or so when the sun is coming in brightly? Is that something that could impact macular degeneration or not?
unlikely. But then again, if you have glare and your eyes are painful, you have
Right.
to listen to your
I
body. Your body has an intelligence.
right. I
You know,
don't. I
but
just
it's
don't.
it's a it's a misconception that people say that they have to avoid ultraviolet light. That's not true. Okay,
Okay.
we got to move on. We have a lot of other people that have questions, so I don't want to spend a lot of time on one
Okay,
topic.
thank you.
Sally, how are you?
Good. Thank you so much for all you do. That's awesome. For over a year, I've had like a white kind of discharge from my left eye, and sometimes it waters more, and it causes my eyelashes to get really sticky. And so I'm constantly going like this, to pull them apart. And what might be causing that, and what do I do to get rid of that?
Okay, number one, I have to be careful because I really can't give medical advice.
Yeah.
You're not an official patient, but I can tell you one of the most common causes of the symptoms you have is called blepharitis, which is inflammation of the eyelashes. So
Mm,
number one, I would recommend that you consult with an eye doctor, get a diagnosis. It sounds like blepharitis, and the treatment for blepharitis is good lid hygiene. Warm compresses, dilute baby shampoo, eyelash scrubs, and then sometimes we use an antibiotic ointment. But
mm,
good lid hygiene is important. Then, of course, too, as we get older, we begin to have dry eyes. And when you have dry eyes, your tears are bacteriostatic. Your tears prevent bacteria from growing. If you have dry eyes, then you don't have that bacteriostatic effect to prevent bacteria from growing on your eyelashes. So it
mm,
can produce a vicious cycle, inflammation of your eyelashes and dry eyes. So
mm,
I would definitely consult with an eye doctor to get a diagnosis. The other thing I like, and we've talked about that on some Substack articles, is ozone eye drops. I
mm,
love ozone eye drops. This is something that empowers you. Um, Unfortunately, you can't buy ozone eye drops. You have to make your own. You buy an inexpensive ozone generator and you bubble the ozone. It's like a little aquarium bubbler. You
mm.
bubble the ozone into saline and then use that as an eye drop. I do have a YouTube video. If you go to YouTube and type my name, Kondrot ozone eye drops, you'll find the video. And I think we have a Substack article on how to make your own ozone eye drops. If we don't, we're definitely going to have to put that out there in the library.
Okay, thank you so much.
Oh, thank you.
Okay.
And Irina, hi. You have to unmute. I should ask you folks where you're from. Irina, where you're from. If when I
Well,
call on you, let me know.
I'm from Canada, but I'm in Mexico right now, as you know.
Wow. You
Yeah, we've
bypassed the
had
US, Canada to
yeah,
Mexico.
yeah, well, we've had a conversation with me here. Um, so thank you again for doing this call. I have I went to see an ophthalmologist here on Friday, and my pressure went up to 23 in my right eye. I've got glaucoma, and she's recommended that I do laser surgery here. I have laser surgery booked in back home at the end of May because I'm here till May. But she was sort of recommending that I do it sooner, not wait till the end of May to do the laser surgery. My eyes getting more blurry, has been more blurry. I've noticed it. She gave me an eye guard to wear at night. She thought maybe I'm putting too much pressure of sleeping on this side. So anyways, I don't know what what would you recommend in terms of laser surgery now, or wait till I get
Well,
back?
number one is glaucoma is more than pressure. You
I
know,
know.
23 can be normal for some people. You can have a pressure of 25 and never lose your vision from glaucoma. Or you can have a pressure of 10 and go blind from glaucoma. So it's
Yeah.
more than pressure. It's the health of the optic nerve. And what eye doctors do, they do visual field tests, peripheral vision, that reflects the health of your optic nerve. And actually, we do pictures of the optic nerve. We measure the actual fibers of the nerve.
Mhm.
So the really determining factor is what's going on with the optic nerve in the visual fields, not so much the pressure. But if you have a pressure of 23 and we see a progressive loss with the nerve fiber layer of visual fields, then we got to lower the pressure. But my goal is, I believe that you got to do things to improve the health of the optic nerve. How do you improve the health of the optic nerve? Well, everything we talk about: stress reduction, exercise, healthy eating, all these things will help improve the health of the optic
Mhm.
nerve.
Mhm.
And also
Well,
specialized treatments like we do, microcurrent, ozone treatment, light therapy, all these
mhm.
things.
Well,
So,
I'm
we do have, I would be happy to review your records and give my opinion. I don't
well,
want to
well,
give
you
you an
have,
opinion
you
right now.
have, you have. We've had a session, and I have sent you my my field vision test, and I have 50% damage in this right eye. So I am, and I'm doing everything that you've suggested. I'm walking on the beach every day, and I'm, reducing screen time, and I'm eating healthy. So I'm doing all those things, which is why I was so surprised when I went to see the ophthalmologist that my pressure was still at 23 when I'm doing, and I've reduced my workload. I've done everything that we talked about,
Well, there's
and
probably
yet the
something,
pressure's still up.
something that's missing, something that's missing. And unfortunately, sometimes in spite of doing everything, the body still degenerates and we still lose vision. And that's why I believe that we need the best of traditional ophthalmology. And there's wonderful eye doctors, and the laser therapy can be extremely beneficial. Sometimes you do need the laser therapy.
Well, I just need to know, I just would like to know whether I should do it now
Yeah,
or
but I can't give
I'm,
you medical advice like that. I think it's
yeah.
a decision you have to make. And maybe talk to Chris, and I'll take another look at your records.
Yes, because I sent
Okay.
them to you. Yeah. Okay, thank you.
Okay. Enjoy Mexico. Mary Ann. Hello, Mary Ann.
Hello. So I'm here in the high desert of Carefree, Arizona, which is just north of Phoenix.
And
And
that's where I used to have my office. I used to have my office in
now,
Cave Creek.
unfortunate timing for me, since I just learned about you. And I actually learned about you from Claudia Muhlenweg and Trisha Kirby from her natural vision coaching.
Hmm.
So I found her within the last year because my eyesight started really degrading after a serious mold infection where I used to work, um, and multiple mold exposures. So, um, okay, so I have kind of a serious cataract in one eye that's really giving me issues, and we've been working with that. But I found out within the last 3.5 months that I have vitreomacular attraction. And it was severe in this side to where the macula was pulled enough off of the retina that it did have a tear in it, a hole. And I was determined that's how I learned about you. I was determined to be one of the like few percent of people that can actually naturally resolve from that. So I've gotten onto bioidentical hormone therapy. I'm taking hyaluronic acid. I'm doing all these natural things that I've been learning about. And I'm trying to increase my odds of being someone who can self-resolve. So I did go to another ophthalmology checkup last week, and with a new doctor that I thought might be a little bit more open-minded about it. And he did take new visuals, the OCT test, and it showed a significant improvement in the right eye, where it's dropping back down, but the fibers are still attached to it. And now the left eye is pulling up. So I guess my question is, what can I do? What can a person hypothetically do to increase the odds of the collagen fibers that are still holding on to the macula to get them to weaken and let it go? Because they said that's the problem. He said, this eye is, the macula is settled back down, but the fibers are still attached to it and they could pull it back up tomorrow. So he
Well,
wants,
as we get older, the vitreous jelly in the eye begins to shrink, and sometimes it attaches onto the retina and causes those traction. So the one thing you need to do is reduce inflammation in your body, and it sounds like you are reducing inflammation. But we do specialized therapies like microcurrent and light therapy, and I'm a very big advocate of homeopathy. Homeopathy is a system of medicine which believes that the body has the ability to heal itself. And then we use certain homeopathic remedies to act as a catalyst to kind of treat that problem. So I think the next step for you would be to consider a homeopathic intervention. Fortunately, in Arizona, we have a lot of really good homeopathic doctors. I used to be the president of the Arizona Homeopathic and Medical Association years ago. And so you can check with that organization, or I'd be
Okay.
happy to do your homeopathic intake.
I love that. Yeah.
Yeah,
Well,
so I
my
would
next,
contact the office or email, Substack, and we can give you that information.
great. I'd really appreciate that. I'm all in to be a success story of this. I'm determined. So, and I also want to thank you for the beautiful work that you're doing in Africa too. Um, yeah, I'm really grateful
Oh, well,
that
thank you. Thank
people
you.
like you and doctors like you are helping these people. So
Uh-huh.
thank
Thank
you
you.
so much.
Okay, have fun in Arizona. Enjoy the heat. Okay, Ellen, how are you? Ellen, where are you from? You have to
Hi.
unmute.
Yes, I'm in Minneapolis, Minnesota. So,
A big change compared to Arizona. How you still have
yeah.
snow in the furrows?
Uh, well, we got a foot last week, and now it's going to be 70. So we're ping-ponging a lot now.
Mhm.
Yeah,
Yeah, well, pretty soon the mosquitoes will come out.
yeah,
Yeah.
they will. Um, yeah, I want to follow up on my question is you already started to address on lid hygiene. And I know that I've read and you've said today about the diluted baby shampoo. Um, and I had been using, I see there's hypochlorous, there's tea tree oils, there are all these different things. And so I was just curious why the baby shampoo and I always thought that had petrochemicals in it, so I've sort of stayed away from that, but maybe I'm wrong with that assumption.
Well, we need something to emulsify the oils and the fat. So
Okay,
like the tea tree oil and things like that may not emulsify the oil. The baby shampoo, you're correct. They do have some petrochemicals, but when you dilute it, it's probably one of the mildest shampoos on the market.
okay. And
Now
what would the
you might want to use like Bronner's you know,
yeah,
soap, which is a little bit more natural.
yeah,
But
we've got that.
yeah, you might want to try that.
What would the dilution be, would you
I
suggest?
would say 1 to 1,
1 to 1? Okay,
1 to 1. And you just want to gently scrub your eyelashes to remove some of the oils and debris that accumulates. And then first the hot compresses. The hot compresses will loosen up the matter, and then the baby shampoo scrubs or the
okay,
Dr. Bronner soap scrubs. And then after that, you can put a little bit of, uh, in some cases, we want to put a little bit of antibiotic ointment or something to reduce the inflammation, but that should be done under, your eye doctor's supervision.
right, 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 okay. And then just with a washcloth to
Yeah,
use
a
the
washcloth. I think that's easier. Some
clean.
people recommend Q-tips, but I think that's too much fussing. Just get a good washcloth at the end of it and use that.
And is it just the lashes or do you try to get to
No, you want the lashes. The problem's in the lashes,
In the lashes, not in the, where the
not in
skin.
the eyelid or inside the eye,
Okay,
the lashes.
all right.
Give
Okay,
that
that,
a shot.
but beg pardon?
Give that a try.
Yeah, I appreciate all the specifics because, you know, you read these things or you hear them and then you try doing them, and I want it to really work, and what the
I
right,
may have to make a video of an actual demonstration.
maybe. And I also
Yeah.
want to thank you about the mission work that you do. That is really lovely about
Oh,
this.
well, thank you. But I'll tell you what, I think my wife and I, we get far more blessings than benefit. You know, we come back from a mission and we're like on cloud number 9 because we just feel so good about ourselves and what we've done. And it just lasts. We just, you know, be honest with you, we can't wait to go back. We're going to be hitting back probably in September. And then, you know, they don't do the eye muscle surgery in Togo. There's a lot of eye doctors there that never heard of it and they don't do it. So I had one doctor watching me do about 4 or 5 cases. And I finally said to him, "Doctor, you're ready to do it yourself." And he did his first case and he was beaming. He was so happy because now he's able to help these children.
Yeah.
You know, and that's the goal, is to make them, you know, not depend on Americans, to
Mhm.
be independent. And so there's some wonderful African surgeons that have such big hearts and are doing a lot of good work, you know, for Africa. All right, we got some masculine energy. Walter. How are you, Walter?
Eh, Let's go back to the sun from San Juan, Puerto Rico.
Uh-huh.
No,
What a beautiful, beautiful island.
yes, yes.
And you have a lot of great alternative doctors there. Vega. Um,
Papo Vega, Gilberto Vega.
yeah, do you know Dr. Vega? He's a good friend of mine. He's from Puerto
Yeah,
Rico. And
yes.
yeah.
I am a pharmacist, and I have been dealing with homeopathy for 30 years and teaching homeopathy, and I know Papo Vega. Yes, sure.
Hmm.
Well, my question is, I'm a pharmacist, a 67-year-old. I don't like to go to the doctor to do my, because I have an alternative medicine. Okay, my eyesight has been I have been noticed that I have blurry vision, and maybe I have some cloudiness, cataracts a little bit. I am using Oclumed, they can't see. I am using Cineraria Maritima. I am using the SkyQ1 drops. I am when it's for yourself, maybe I am not the best person to treat myself in homeopathy, but I use lycopodium, I use phosphorus, but lately I am using Staphylococcus aureus, and
Yeah, but I'll tell you what, it's a mistake. You know what they say? The doctor who treats himself has a fool for a patient. But I'll tell you what, you know, when I had my severe asthma, and I'll tell you what, I almost died twice. And I went to a homeopathic doctor. They prescribed a remedy, and I thought the doctor was crazy. I said, "That's not my remedy. That's not me." And it was a remedy that cured my asthma. So it's really hard for us to understand ourselves. That's why I think you need to have a professional, you know, someone take your case. But the other thing you need to do, and, you know, cataracts are a very common problem. And I think we have to look at the underlying, what causes the cataracts. You can look at it from the homeopathic perspective. Maybe there's a disturbance in the body, some emotional type thing. But very common, it's vitamin C deficiency. Dr. Bruce Levy wrote a book on vitamin C, and he has a brilliant hypothesis. He feels that many of our diseases are due to focal scurvy. Now, scurvy doesn't exist in the US because, you know, right now they have a little bit of vitamin C in Fruit Loop cereal. So people are not completely deficient from vitamin C. But we're under stress, we need more vitamin C. And, you know, when I'm in Africa, I see teenagers with advanced cataracts, and it's all due to nutrition. So I do recommend that if you are getting early cataracts, you want to take some supplemental vitamin C.
Okay.
And I would recommend maybe 3 grams of vitamin C a day. And there are some products that are non-GMO. I like the powdered vitamin C. I think one product, what I use actually is called Enercy. It's a little packet, non-GMO, put it in water or smoothie, and it's a little bit tolerated compared to pills. So 3 grams of vitamin C a day. The other thing is heavy metal toxicity, elevated lead. And I think everybody is exposed to lead now.
I have
And
been
that's a
detoxing
contributing.
myself.
Yeah, that's detoxification can be helpful.
My biggest question for you, haven't been gone to the ophthalmologist yet. I will love to see the possibility to go directly to your office. How can I proceed?
Well, I do a complimentary record review, no charge.
But if I don't have record, if I have,
Well, I need the records.
so you suggest me to go here to
And
ophthalmologist?
yo hablo un poquito español. So it's easy to read the Spanish medical records because a lot of diseases are, it's very similar from the Latin derivative. But I absolutely need a copy of your records because this way I can understand exactly what's going on in your eye because it may be something else, something in addition to the cataract. But go to freeconsult.us and I do a complimentary record review and give you advice on what to do. But if you'd like to become a patient, then contact the office and then we can schedule that.
Okay. Okay. Thank you very much.
Okay, nice talking to you.
Okay.
Okay, next, Karen. Hello,
Yes.
Karen. Karen Deutsch. And where are you from?
I'm from Germany, Nuremberg, Germany.
Oh,
Yes.
good morning. Good morning.
Yeah, good morning.
No, it's in the afternoon. It's in the afternoon in Germany.
Yeah, it's almost 2:30 in the afternoon. Okay.
Yeah.
I was also, or I also have that cataract, and following up on vitamin C, my question is, I'm taking vitamin C for a long, long time, much more than 3 grams per day, also in powder form. If I assume my body has a hard time to get the vitamins, the minerals into the cells, do you have any suggestions so I could improve kind of the uptake of the vitamin C in my eye cells or the lens cells?
That's a good question. I think the health of the gut has a lot to do with it.
Okay.
And more doctors are finding out that the health of the gut determines the health of the eye and the brain. So I would recommend, taking some probiotics. But our ancestors knew the best way to take care of our gut by using fermented foods. And of course, you have a lot of good sauerkraut in Germany.
Yeah, I'm eating almost every day a few forkfuls of sauerkraut or kimchi or
Yeah,
other
wonderful.
fermented stuff. So I'm
That's
already
a way.
doing this.
And then, you may want to consider taking some probiotics, some supplemental probiotics to help improve the health of your gut. But, talking about the gut, if you have tendency towards diarrhea, constipation, gas, things like that, that could be some signs that your gut's not healthy. There was a brilliant homeopathic doctor, Dr. Bach from England, who developed bowel nosodes, homeopathic nosodes to improve the health of the gut. And I've been using them. You may want to consult with one of the health practitioners in Germany regarding the bowel nosodes to improve. They've been found very helpful to treat underlying causes of disease.
Could you please repeat his name?
It's BACH.
BACH.
But it actually, You've heard of the Bach flower remedies,
Mhm.
but the correct way to pronounce his name is Batch.
Okay.
Batch.
Okay.
But he's the same gentleman who developed the Bach batch flower remedies. But a
Oh,
lot of his
okay.
research before that was developing bowel nosodes. And he was looking at a lot of chronic diseases. And homeopathic doctors still use these bowel nosodes. And I'm a big advocate of them too. I think they can
Okay.
be very, very effective. You can
Mhm.
research the bowel nosodes.
Okay. Thank you very much.
Okay, thank you for being part of Substack. Oh, guess what? I'm working with a German publisher right now, and they're going to be publishing my new book in German and English.
Mhm.
Can you believe that? So I'm kind of excited. I'm working with a German publishing company.
You need to let me know once it's on the market.
Okay, I will. I will.
Okay.
Thank
Thank you.
you. Katrina, hello. Good morning. How are you? Where are you from? You have to unmute, Katrina. Okay, I think you're unmuted, but we can't see you. You're
Okay,
kind of off to
thank
the
you.
side.
Thank you. Hi, good morning. I'm in Henderson, Nevada, and it's kind of early here. And yes, I have a couple questions for you. Some of them you answered with the cataracts questions from other people. And that was one of the questions. Some of the other questions I have are in two of your different articles, you talked about chocolate, dark chocolate, and you said in one article that it was good and one article that it was bad. And I was like, which is it?
Okay, well,
Um,
number one, I think that chocolate can be very healthy for you, but you want to
okay,
avoid a lot of the milk sugars. The dark chocolate has a lot
right.
of health benefits. But
Okay,
anything in excess is harmful to the body. Water's too good for you, but you have too much water, you're going to drown. And and I believe in moderation and balance in our body.
mhm, okay,
But
good.
chocolate is a gift from God.
I think so too. That's why I'm asking. I'm
All
like,
right, good.
I want my chocolate. I want my chocolate.
Uh-huh.
So, and the
But
other
now
question,
if you're a diabetic and your A1C is 20, that's a different story. But
mhm,
the problem with chocolate is the milk sugar.
okay, okay. Um, the other question I had was, I'm just curious because I keep thinking about the work that you do, and unfortunately, you're not going to be able to live forever. And I'm wondering if you are training someone else to, with your knowledge and stuff, so that this can continue on for future generations to have
Hey,
somebody.
what do you mean? What do you mean I'm not going to live forever?
I just saying, most of us don't. Most of us don't.
No, that's a
Um,
good question. Every Sunday at 9 o'clock for 1 to 2 hours, I meet with a group of alternative eye doctors and I'm teaching them homeopathy and alternative medicine. So we have about 5 eye doctors. And one of them, believe it or not, is from Nashville, Tennessee,
Oh.
Dr. Sarah Jang. She's a brilliant eye doctor who has a passion for homeopathy and microcurrents. So we have a whole new generation that's
good.
ready to come up.
And that's great because I keep thinking about that, thinking, gosh, if all of the stuff that you know is lost, it would just be such a tragedy. So that's,
Well,
and I keep,
everything's in writing, all my books
well, that's good.
and, the YouTube articles. So everything's out there. And I always tell people that, my book, The 10 Essentials to Save Your Sight, everything is in that book. Everything that we talk about, especially the first 3 chapters. If you haven't read the book, it's a free download. Go to healingtheeye.com and right on the home page, you get
Is
a
it,
download a PDF.
is it in audiobook?
And it is an audiobook too.
Oh, great, great.
I'm
Okay,
pretty sure. I have to check.
yeah.
Is
'Cause
it an
I,
audiobook? 10 Essentials, an audiobook? Yeah, I think it is. Go on
okay, great.
Amazon, you can get the audiobook.
Okay, great. That's good to know. And what was the title again? Everything
10 Essentials to Save Your Sight.
can, okay, got it. Okay. Yeah, I think that's all my questions this morning. Like I said,
Okay, yeah,
several
but
other
you have to
questions.
limit maybe the questions. You had good questions. You have to limit it to one because we have a lot of other people that have a question. And so if you could limit it to one, and then, if everybody has their question answered, then we can come back to you. Okay?
Okay, thank you.
Okay, Beth,
Hello.
and where are you located? Oh, Beth, I think you're muted.
Oh, okay.
Now
Um,
you're back.
I'm here with my husband, Rob. We're in northern Utah. And I have a question and he has a question about glaucoma, if it's okay.
Yep.
My question is, over the last year, my vision has really been decreasing a lot. And I have an appointment in a couple of weeks for an updated vision check, but I would guess it's probably gone worse by at least a half diopter, maybe a diopter. I'm like at a -8 right now. And I'm just, as far as I know, last time I had an appointment, my eyes were healthy, but the vision is just getting blurrier and blurrier. And I had an injury in the right eye in junior high, and so there's a cataract there, and there's probably an age one forming in the left eye. But I'm trying to determine, how do I know what's causing the additional blurriness? I know if I go to the eye doctor, he's just going to give me a stronger prescription, but I want to heal it and prevent it. But I don't know what approach to take. I do a lot of just natural health stuff in general, but it's not helping with the blurriness.
Well, I think, number one, we have to find out if there's something going on in terms of a pathological change in your eye, such as a cataract or glaucoma or macular degeneration. But if it's just simply your eye muscles are getting weaker and your prescription is changing, then we have to address that. And there was a brilliant ophthalmologist turn of the century, Dr. William Bates, who felt that it was stress and emotional contributing factors to cause nearsightedness and changes in your glasses. So I would definitely start to do some reading on Dr. Bates. In fact, one of the chapters in my book is all about eye exercises in Dr. Bates. But one of his best eye exercises is called palming, where you close your eyes, and it's a wonderful exercise because it's kind of like meditation for the eyes. You want to close your eyes and relax those eye muscles. Also, our body is a electromagnetic energy system. Energy comes from the tip of our palm. So when we do this, we're putting energy. So relaxation, doing the palming, and he has a lot of other exercises to do, which I don't have time to get into, but there's a chapter in my book on that, or you can go online. And I used when I was in my residency, studying to be an eye surgeon, we made fun of Dr. Bates. You know, would have a couple of beers and be laughing about him, and the guy's an idiot. And then I came across a book by Aldous Huxley. And I love Huxley's writing. He wrote Brave New World, Doors of Perception. And he wrote a book called The Art of Seeing. And Huxley had horrible vision, and no one could help him. Being a famous author, he went from clinic to clinic. And then he discovered the work of Dr. Bates, and he cured his eye problem using the Bates method. And after reading that book, I said, hey, there may be something to this. So you may want to read the book called The Art of Seeing by Aldous Huxley. I don't know if it's still in print because when I found out about his book, it was hard to get. And then I found a publisher who only had 2 cases of the book. And I think I bought all the books at that time. And I was,
Well,
giving them to patients in the office. So Aldous Huxley, The Art of Seeing.
okay, thank you. Now my husband has a question.
Hi,
Hello, husband. What's your name?
Rob.
Rob. Hi, Rob.
Yeah, thanks for taking the calls. I take Lamprost for my eyes,
Uh-huh.
and I was hoping not to take it anymore. A couple of things. One, I had heard that eye drops for glaucoma, and I don't know what kind it is. A recent study indicated that it contributes to dementia. I don't want dementia for her. I mean, for me, it'd probably be okay. I wouldn't even know that I had a problem. But I don't know if Lamprost is the item that does it or not. I was hoping on not having to use eye drops anymore. So I reduced my salt intake for a week and was hoping that maybe it would reduce the pressure in my eyes. And I went and had my pressure checked, and one eye was 26 and the other was 14. And so it didn't seem to make the difference that I wanted to. And I'm trying to get off of Lamprost. And I don't know if it's something that's bad, chronically bad or not.
Well, anytime you take a petropharmaceutical medication, there are side effects. And I think out of all the glaucoma medications, the latanoprost that you're taking is probably one of the safest because you just take one drop at night before you go to bed. But glaucoma, as I mentioned, is more than pressure. It's the health of the optic nerve. So even though your eye pressure is 26, you may not need any eye drops. It depends on what's going on with your optic nerve. And also, you got to look at doing things to improve the health of your optic nerve. Like, for example, studies have shown that exercise will help reduce the pressure. Daily exercise, also meditation, stress reduction. I believe that glaucoma is a disease of the autonomic nervous system, and that we're in a state of stress, that causes an elevation of the pressure. Although a lot of eye doctors will deny that. Some studies have shown that meditation can have a very positive effect. Meditation, deep breathing, positive affirmations, prayer, things to reduce the stress.
Yeah.
So I'd be happy to take a look at your records just to see how advanced your glaucoma is and if you indeed need eye drops. You may not need eye drops if there's no damage to your optic nerve. A lot of eye doctors treat pressure, and we're trained to do that. If you have a high pressure, you got to start taking eye drops. But you may not have glaucoma. You may want to start to do other things to improve the health of your eye besides taking eye drops.
But my field of vision test, I've had 3, and they really aren't that different from one another.
Yeah, so that's a good sign. And the nerve, it's called a nerve fiber layer test, where we look at the health of the optic nerve. That would be another test that we'd want to look at too.
Thank you.
Okay, well, thank you. Let's see, we got Allison. Where are you from, Allison?
Okay, can you hear me?
Yep, I hear you.
It's Allison and Bob. Allison is the one who originally signed up. We have a number of quick questions. I know there's an issue of time. The first question, I have glaucoma in both eyes, and my ophthalmologist was recommending SLT. I think that's the laser surgery. And I was just wondering, what's your recommendation with that? Just a quick question on that. Because I postponed it. I postponed it because he said your eyes would be blurry for a while, and I'm just going to wait and talk with you and just see what your recommendation was.
Well, it's interesting. I always felt that if you have glaucoma, you need some type of treatment. And I'm assuming that you're doing things to improve the health of your optic nerve, reducing stress, and doing all the alternative things.
Sure.
But if it comes down to a decision to use eye drops or doing the laser, I always felt that, the laser should be the last resort. But lately, my opinion has changed. I think that sometimes the laser therapy may be one of the best therapies to begin treatment with because you avoid the toxic petrochemicals taking them daily in your eye. Now, what the laser does, and the analogy is, let's say you have a bathtub and the drain is blocked with hair and lint. The water's going to accumulate in the bathtub and overflow. So in your eye, the outflow, the trabecular meshwork is blocked and you have an increase in pressure. So the laser kind of cleans the lint, cleans the drainage valve to help lower the pressure. So I think the laser is a very good option, especially the SLT. It's a very gentle laser procedure, very, very low side effects. So anytime we do surgery, we always look at the risk benefit. What are the risks? What are the benefits? And the laser has an extremely low risk and a high benefit.
Excellent, thank you. I'll probably reschedule that. The next question, I noted there's a video we found online. A woman had difficulties, and then she went to you and got microcurrent and color therapy, I think, and cold therapy, and her results were dramatic. And she was just talking about how great you got her eyesight back. Does microcurrent and color therapy work or help with glaucoma? Is that something I should
That's
look into?
I have to smile because if you would ask your eye doctor, "Hey doc, will color therapy help my glaucoma?" He'll
Right.
probably think you're a nutcase, right?
Well, that's why I'm online talking to you.
Yeah.
That's
And then he may
right.
say, are you on Substack? Are you on that Kondrot vision thing? But our most prestigious journal, um, the American Journal of Ophthalmology, in 1948, there were 2 articles published on the benefits of light therapy with glaucoma. There was a study done that showed that light therapy can lower the pressure. And if you email me, I can send you a copy of that article. So light therapy can help, and certainly microcurrent. There's been hundreds of studies done to show that microcurrent improves circulation, helps regeneration, etc. So both of those modalities can help.
So we're in Florida, and I think you recommended Dr. McNair, and I
Yeah,
called him once, and I didn't get much of a response. It was like he was doing cataract surgery. I thought I was looking for more of the alternative types of things you're discussing now. Does he do that sort of a thing? I need to just press forward to get
he's
to the.
actually. I taught him how to do microcurrent, but I think he's busy with his practice and cataract surgery, so I don't know how much energy he's putting into alternative.
That was the sense I got when I called him. Is there anyone else in Florida that you could recommend for
No,
microcurrent and color therapy?
but I can work with you. You know, we do work with patients in Florida. I still have my Florida license, so send me your records, contact the office, and we can get you started on these programs.
I plan to do that. And my wife had very quickly her left eye. She had
Narrow angle glaucoma.
narrow angle glaucoma, and she had a partial corneal transplant. So that eye is we're working with that, and she's got drops for that. But the right eye is she does most of the driving now, and I'm just really concerned to help her as much as possible to keep that right eye healthy. And your idea of doing the oxygen therapy, the oxygen drops.
Yeah, the ozone.
We noted you have a video. We'll find that and we'll take a look at that. We used to have.
We have them in storage.
Yeah, we have all the what is the
in another state? Ozone generator.
ozone generator. We have several. They're in storage right now. I guess we'd have to buy another one, or is there some place where we can actually purchase those oxygen drops from you or
No,
from?
no, unfortunately, you have to make your own oxygen drops because the half-life of ozone in saline is very short.
Okay. All right.
So
So
you'd
we'll.
have to purchase an ozone generator, but you could contact the office and they can give you information on that.
All right. We will contact the office and send you both of our lab results, all our records, and then from there, we'd like to probably schedule an appointment to meet with you
Okay, great.
online.
What part of Florida do you live?
But we're in Englewood, South Venice.
Yeah, I think McNair is up. He's near Ocala, isn't he?
Yeah, yes, he is.
Yeah, well, good. I look forward to working with both of you then.
Well, I pulled down all our records and PDF them. I'm ready to send them to you. So
Okay,
we'll
great.
pursue that. Thank you.
Thank you. Sandra, how are you?
Hi, I'm here in New Brunswick, Canada. Good to check in with you.
Yeah, good to see you again.
Thank you. I just wanted to follow up. I went through my visual fields. I'm down to I have lost about 11% of my vision in my left eye, 5% change from March till October. And then I have this blurriness, so I don't know what's the small cataract and what's the glaucoma that I have. My pressures have been good from 12 to 17 in the last year, but I still have this blurriness. You changed my homeopathy, so I've been on that for a week. I don't see a change in my vision. I don't know if that's supposed to change.
Well, usually with a homeopathic remedy, we like to see a positive shift in your body. Typically, it's more of a mental emotional, maybe feeling
Oh,
more energy, calmer, less anxiety.
probably less
Physical,
anxiety. I would say that's probably
yeah, physical changes may occur more slowly, after a couple weeks to a month. So I would just say continue the homeopathic remedy.
okay. And the other part is I have elevated lead. I did just get a blood test result back, and that also says I have elevated blood or lead. So I'm in Canada, so I can't get all of the stuff that you use. I was able to get the rectal suppository, but I wasn't able to get the oral.
No, I'm surprised because the oral you should be able to get online.
I had to get a friend in the US send me the stuff you even recommend on Amazon. Now
Mm.
I had a acupuncturist. She does testing for different things for your body, and she's saying that a test is not helpful for my body. So that was a little bit confusing, but I'm not quite sure what to do with all that.
Well, we'll probably have to set up a personal consult later since you're a patient of mine and go over that.
Okay.
Okay.
Yeah,
So
that's
talk to Chris and we get something.
okay. Thank you.
Okay. I'll talk to you later.
Yes, good to see you.
Good to see you. Carol. Hi, Carol. And where are you from? Oh, you're muted. You have to unmute. Can't hear you, Carol. I see your lips moving. Something's wrong. Yeah, your microphone may not be working because it indicates that you are unmuted. Do you have a microphone there? Something's wrong here. You know what? I usually don't like the messages, but you want to type your message in chat? While you're typing the message, let's go to Karen again. Karen has another question.
Yes, thank you very much. I have not yet bought the ozone generator because I also have mildly dry eyes. If I produce the ozonated eye drops, would I be able to add some potassium ascorbate powder in it in order to get the vitamin C closer to the eye?
No, you don't want to mix anything with the ozone
Okay,
because the ozone is highly reactive and it can react with different substances and make them some toxic products.
okay.
That's why we like preservative-free saline. Ozone
Mhm.
can very
Okay.
highly reactive and it can cause, so I would not mix it with anything.
And if I use some other eye drops, which are not reactive, would I be able to mix some potassium ascorbate powder in it?
Well, one thing interesting, the microcurrent acts as a carrier. So, when you do the microcurrent therapy, I have some patients use frankincense oil, or if they're using the Oclumed drops, they put a drop in the eye. Then they do the microcurrent. The microcurrent acts as a carrier, taking it inside the eye. So you may want to try that.
Okay, I have frankincense oil here. Where would I put it? On the eyelid?
You would dilute the frankincense maybe with olive oil and put a little bit on the eyelid.
Okay.
Or what I like to do, if you're doing the microcurrent, soak your washcloth in a solution of frankincense and water and then put that on. You don't need much. You don't want to put the full strength on your eye, that can be toxic.
Mm-hmm. Thank you.
Okay, there was a comment here. Can't find the ozone article on your website. You have to go to YouTube. Go to YouTube and then type in my name. If you can't find it, if you go to kondrotyoutube.com, all one word, kondrotyoutube.com, you'll go to my channel. And then you can type in ozone. I have about 3 or 4 videos on ozone, rectal inflation, auricular, ozone eye drops. If you still can't find it, email the office and we can send it to you. And there was another question here about wet macular degeneration. Does homeopathy help reduce the inflammation? Absolutely. Absolutely. In fact, in the early 1900s, the majority of eye doctors practiced homeopathy. And there's a lot of good homeopathic remedies that can help. Okay, Carol finally got through. You're going to have to work on your microphone. Advanced cataracts. Have you had success treating holistically, or do you recommend surgery? Well, out of all the conditions I treat, cataracts are probably the toughest. They're the hardest to treat because we have to treat the underlying cause. I would rather treat wet macular degeneration or glaucoma than cataracts. Now, cataract surgery is not the end of the world. It's probably one of the most successful operations that we do. And a lot of patients ask me, well, Dr. Kondrot, if you're so much into alternative, why are you going to Africa doing cataract surgery? Well, these people are blind from cataracts, and I can't talk to them about doing chelation and changing their diet. They're happy to get a meal a day. You know, they're not able to make those changes. Here in the US, we're fortunate that we can take those steps, you know, to improve our general health. So probably one of the things that I like a lot is the Oclumet. But I'm not familiar with the LifeWave stem cell patches that you're talking about. But I know that palming can help. But I have seen that the Oclumet eye drops, it addresses the underlying cause, because when you get a cataract, a couple of things take place. Your ascorbic acid or vitamin C levels decrease in the aqueous around the lens of the eye, and also glutathione. So the Oclumet drops is a precursor to it has vitamin C in it and precursors to the glutathione, which makes sense to me. So that's why I like the glutathione eye drops. All right, well, we're coming to an end here, and I want to thank everybody for joining Substack. And also I want to thank for your support and, you know, for the mission work that we're doing in Africa. And I'll look forward to meeting everybody next month. So have a good month, and look forward to seeing everybody again. Blessings to everyone. Take care. Bye.
Thank you. Thank you so much.